Aloha everyone, we're going to go ahead and get started. I just want to welcome you all to the Hawaii Public Health Training Hui's April webinar, the Health Risks of Vaping for Teens webinar by 808NOVAPE. Next slide, Kevin. Organizers of this training is the Hawaii Public Health Institute, and my name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator for Hi-Fi. We also have Makamai Namahoe, our Grants, Contracts, and Operations Assistant. We're also assisted by the Hawaii Public Health Training Hui's Steering Committee, made up of 14 members from different or a variety of organizations across the state. Next slide. I'd like to thank our sponsors and partners for today, the Hawaii Public Health Training Hui, the Western Region Public Health Training Center, as well as the Public Health Learning Network. Learning outcomes for today's webinar: compare national, state, and local Hawaii youth vaping rates, educate the public on the potential health impacts of youth vaping, address the recent changes in ESD technology that increase the vulnerability of youth to ESD use and nicotine addiction, and examine current resources that exist for youth vaping cessation. It's my honor to introduce you to my coworker and our guest speaker today, Kevin Ramirez. Kevin has been coordinating the 808 No Vape campaign for the Hawaii Public Health Institute since 2017. Over the course of the past 3 years, Kevin has worked directly with schools to have youth-created multimedia content featured as a major component of the campaign. Kevin has also conducted dozens of presentations in schools across the state to students, teachers, and parents around the health risks of vaping for teens. Kevin was a featured presenter alongside Dr. Bonnie Halpern-Felsher at the Stanford Tobacco Prevention Toolkit at Hi-Fi's Clearing the Cloud ESD conference in 2018, and most recently was a featured presenter at the National Conference on Tobacco and or Health held in Minneapolis, Minnesota in 2019. So without further ado, I would like to turn it over to Kevin.
All right. Thank you, Steph, for the introduction, and Maka for your behind-the-scenes support. And thank you also to all the networks that are involved in putting these trainings together. My name is Kevin Ramirez. I'm the project coordinator for the 808 No Vape campaign, which is the Youth ESD Prevention Project. And ESD stands for electronic smoking devices, and that's how within Hawaii state law, vaping devices and e-cigarettes are defined as electronic smoking devices. And obviously, our campaign is one of prevention. We are here to educate teens in high school, middle school, elementary school, the teachers and their parents about the health risks of vaping. Because we are in the midst of a vaping epidemic nationally and have been in one here in the state of Hawaii for many years. So the work of Hi-Fi, real briefly, we do a lot of work around public health. We work with a lot of partner organizations, community organizations, coordinating coalitions for public health. So we have a HEAL coalition, which stands for Healthy Eating, Active Living. We also coordinate the Hawaii Farm to School Hui. We are involved in work educating youth around prevention of drugs and alcohol in Maui. So the 808 No Vape campaign really comes under the work that Hawaii Public Health does, coordinating the Coalition for Tobacco-Free Hawaii. The Coalition for Tobacco-Free Hawaii has spearheaded the work to make all workplaces, restaurants, bars, and parks smoke-free, and made Hawaii the first state to raise the age of sale from 18 to 21 to purchase tobacco products. As e-cigarette use amongst teens in Hawaii has been steadily, as cigarette use among teens in Hawaii has steadily been declining, the use of ESDs or electronic smoking devices has risen rapidly. And as part of our ongoing work on this issue, the Youth ESD Prevention Project started in 2017. Now we partner, as already mentioned, we partner with dozens of schools to educate students on the issue, have students produce creative multimedia messages aimed at informing and encouraging their peers to either quit vaping or never start to begin with. So this particular youth-driven effort, the 808 No Vape campaign, officially kicked off in May 2018. So today's presentation will provide an overview on Hawaii's youth vaping epidemic, some of the health risks associated with using these electronic nicotine delivery systems, otherwise known as vaping. So before we get to the e-cigarettes, which are just the latest innovation of tobacco product, we'll revisit what we already know about their less technologically advanced parent, cigarettes. When talking to teens about cigarettes and e-cigarettes, it becomes clear that there's somewhat of a disconnect between the two. Teens know a lot more about the health risks of smoking cigarettes compared to the health risks of e-cigarettes. And there's a couple of reasons for this disconnect. One reason is simply due to time. So cigarettes have been around a lot longer than e-cigarettes. Cigarettes have been around for over 100 years, and we have over 60 years of research on the negative health effects of smoking cigarettes. E-cigarettes have been around for a little over 10 years. And in those 10 years, the products themselves have gone through several different evolutions, affecting not only the device itself, but the nicotine e-juice, the heating elements, the batteries, etc. While we don't have decades of research on the negative health effects of vaping, we do have a growing body of studies. And what those studies are showing is that vaping and using e-cigarettes is harmful to teens and youth. The second reason for a disconnect between cigarettes and e-cigarettes is due to the e-cigarette and vaping industry's marketing strategy. So when these products first came on the US market in 2006, 2007, and up until 2016, companies were marketing e-cigarettes and vaping as safe, safer than cigarettes, less harmful than smoking, and in some cases they were marketed as healthy. As more and more people became aware and informed about the risks of smoking, smoking rates have been steadily declining. And the tobacco industry is keenly aware of this fact and is placing more and more emphasis on their electronic smoking products. Of course, they want people to disconnect cigarettes from e-cigarettes. Only in recent years have studies and research begun to show that vaping and using e-cigarettes exposes you to some of the same carcinogens as smoking cigarettes. So in spite of the declining rates of cigarette smoking in the United States, tobacco-related disease still remains the #1 cause of preventable deaths, not only in the United States, the state of Hawaii, but in the world. So every year in the United States, approximately 7,000 people die from AIDS, 16,000 people die from gun-related homicides, 29,000 people die from alcohol-related diseases, and around 33,000 die in car accidents each year in the United States. And that's a whole lot of people, about upwards of 85,000. Now, tobacco-related disease kills more than all of that combined. Almost 500,000 people, 480,000 people die each year in the US from tobacco-related diseases. And those are namely lung disease, lung cancer, cancers of the throat or mouth, and heart disease, cardiovascular disease, which can lead to strokes and heart attacks. So when people are confronted with these numbers, especially students in middle schools, high schools, they're completely shocked to see how many people die each year from tobacco products. And there's a range of tobacco products. There's cigarettes, there's cigars, there's loose leaf tobacco for roll your own cigarette or for pipes or even for hookah. There's chewing tobacco and dip. And then the most recent iteration of tobacco product. And at the moment, most popular among youth and teenagers is the e-cigarettes and the vapes. Here in the state of Hawaii, approximately 1,400 people die each year from tobacco-related diseases. And then when you look at the planet as a whole, the World Health Organization estimates around 8 million people die globally from tobacco-related diseases. And within that 8 million, they say that 7 million die from direct use, 1.2 million die from secondhand smoke. And since we're in the middle of this COVID epidemic, I just want to add that the World Health Organization estimates that around 250,000 to 500,000 deaths occur each year globally from the flu. Just to put that in perspective, 500,000 deaths globally from the flu, 7 million from smoking tobacco and tobacco products. And currently, globally, COVID deaths are almost at 190,000, just to put all these numbers in perspective. A lot of times when I'm talking to students, they get real curious about, well, what is it about tobacco that kills so many people? So we start with the basics. What is tobacco? So tobacco is a plant. The leaves of the plant are cut off, dried, and cured for the mass production of cigarettes. Now, inside the tobacco plant, there's a drug called nicotine, and this is extremely addictive. It is actually one of the most addictive drugs or chemicals on the planet. It's just as addictive as illegal drugs like heroin and cocaine. Okay, so in small amounts, nicotine can stimulate the nervous system, make you feel like you have more energy. Your heart rate and blood pressure will start to increase. However, too much nicotine can make someone feel sick, nauseous, make you feel dizzy, lightheaded. And nicotine is a legal drug. You do have to be 21 years old to purchase the product, but it is easily accessible for teens, as evidenced by the vaping epidemic that is sweeping over the country and has been here in Hawaii for several years. So as I said, cigarettes have been around for a long time, over 100 years. It's grown into $1 billion industry. Tobacco companies literally make billions of dollars a year in cigarette sales. And these are powerful companies that are able to keep this lethal product on the market. And the compromise that governments have to come up with is they have to regulate these products to make them as less harmful as possible. When you look at the 60 years of scientific and medical research on cigarettes and the negative health impacts, we know that when you light a cigarette, it creates smoke, and when you inhale that smoke into your lungs, you're exposing your body through the lungs to over 7,300 chemicals. Okay, so not all of those chemicals can lead to death, but not one of those chemicals is good for you or good for your health. Now, on the other side of that cigarette, you see this 70 number, and 70 is the number of chemicals and compounds that have confirmed carcinogenic activity that have been found in combustible cigarettes. Now, e-cigarettes haven't been around for 100 years. We don't have 60 years of research on e-cigarettes. We have about 10, but the 10 years of research is good. And it shows us some very clear harms when it comes to e-cigarettes and particularly to youth. So on this slide, you can see that 2 carcinogens identified, a carcinogen, benzene, and a possible human carcinogen, acrolein, both found and identified in cigarettes, have also been found in e-cigarettes. So the number of carcinogenic chemicals and compounds that have actually been documented in e-cigarettes is much more than 2. It's close to around 2 dozen at the moment. Okay, so we're going to look at the difference in usage rates of e-cigarettes and combustible cigarettes for teenagers. Okay, so that's what this graph is showing. So that's represented in 2 colored lines, a dark blue line and a light blue line. The dark blue line signifies teen use, high school student use of combustible cigarettes in the United States. And as you can see in 2011, compared to 2019, that line is declining. In 2011, it was approximately 16% of high school students using combustible cigarettes. And in 2019, that has come down to about 6%. High school students using combustible cigarettes. And that is good. That is good news. Mind you, off the chart to the left, back in the 1990s, about 20 to 30 years ago, high school students were using combustible cigarettes to the tune of around 30%. Some states higher, some states lower. So a lot of education and prevention work has gone into that to bring that result down. Not only the education and awareness campaigns, but legislation, making sure that people aren't smoking in restaurants and movie theaters and bars anymore, as they were at one time in the not too distant past. So smoking rates, combustible rates among high school students are very low, nationally and here in the state of Hawaii, lowest they've ever been recorded. Now, when you focus your attention on the light blue line, which signifies high school students' use of e-cigarettes, we see quite a different picture. It starts in the low area in 2011, which happens to be the first year that departments of health were actually taking surveys of high school students in their use of e-cigarettes. So nationally in 2011, it was about 2%, or maybe 1.5, I believe. And as you follow through the years, it essentially continues to increase, reaching a peak in 2015 of about 16, 17%, slightly dipping in the following years, but then really rapidly increasing in from 2017 to 2019. In 2019, it was clocked at about 28.5% for high school students. And thus, the United States Food and Drug Administration, the Surgeon General of the United States, both held press conferences and declared a youth vaping epidemic, and instructing departments of health, public health agencies to do as much as we can to reduce the number of teens that are using these products. So that's where things stand now, but I would like to bring your attention to Hawaii. These are national figures that you're looking at. And Hawaii has always had a higher level of teen vaping than national statistics show. So in 2011, the first year that this survey was done for high school students nationally on e-cigarette use, and the national rate showed about 1.52%. Here in the state of Hawaii, it was already at 5%. Okay, so it's already elevated multiple times. The most recent data that we have for high school students here in the state of Hawaii is actually from 2017. And if you look at the national chart, in 2017, nationally, high school students were vaping or using e-cigarettes to the tune of about 12%. Okay. In 2017, here in Hawaii, high school students were vaping to the tune of 25%. So that's almost double. Now, we do have 2019 survey results that are currently being prepared to be released, and that'll happen sometime this year. But what you're looking at on screen now is 2017 high school rate of teen vaping. In red, 25%, 1 in 4 were currently using e-cigarettes. That means they were vaping daily. A number in blue to the right, 42%, is a number signifying how many high school students in Hawaii tried vaping at least once. Okay, so much higher than 2017 national figures. Now, the 808 No Vape campaign is a state campaign, and I want to point out that these are state averages. The state of Hawaii is unique in the sense that we are an island state, so we have neighbor islands, neighboring counties. So it's interesting and it's crucial as a 808 No Vape campaign coordinator to understand the vaping rate, the state average, and if there's any variance in some of our counties. So let's take a look. The state averages for high school students vaping in the state of Hawaii were 25%. That was the figure in red for daily vapors. And blue was at least one time. So when you overlay the neighbor island, neighbor county daily vaping rates, you can see that Oahu at 22% is actually the lowest. Okay, that's bringing the state average down. And then you look at the highest number, that 34% is on Hawaii Island or Hawaii County, the Big Island, at 34%. So that's almost a full 10% higher than the state average. And then when you look at high school students' use of e-cigarettes, who've tried it at least one time, we're in the 50% or approaching 50% in every county, every island except Oahu. Middle school students aren't far behind. When you look at the rate of middle school students vaping currently daily in the state of Hawaii versus those who've tried it at least once, the figures are 15% and 27%. Now, Hawaii at 25%, 2017 numbers, has the second highest rate of high school kids vaping in the country. Our middle schoolers have the #1 rate of middle school kids vaping in the country at 15%. 27% have tried it at least once. Again, state averages, and I'd like to bring your attention to look at our neighboring islands and neighboring counties. So 15 and 27 were the averages. You can see it's well above 15% in every county except Oahu or Honolulu, peaking out at 23% in Hawaii County in the Big Island of Hawaii. In terms of middle school students who've tried it at least once, we're in the 30%. Again, the highest is Hawaii County, the Big Island of Hawaii. So these are interesting figures for us as a campaign that does messaging, that does education, where we need to direct perhaps more of our messaging and more of our educational efforts. So the next slide I would share would be elementary school students. However, we don't have a slide for elementary school students in terms of rates of vaping. And that's because the departments of health here in Hawaii and nationally don't go into elementary schools asking 5th, 4th graders, how many beers and cigarettes are you drinking a year? Does that mean we don't have a vaping problem in elementary schools? No, we definitely do. I can attest to that because I've been requested to do many elementary school presentations, not only for students in as young as 4th grade, but also for the faculty and staff, and also for the families and parents. And I can tell you that 5th graders, 4th graders are getting busted at elementary schools for bringing vapes to class, for vaping at school in the classroom. And in some cases, we have examples where elementary school students are being sold e-cigarettes and vaping devices at the stores in their community and bringing them to school and getting caught. So we know that this is a problem that affects all of our students from elementary, middle, through high school, even into college. So that wraps the youth vaping epidemic here in Hawaii. We're going to move into e-cigarettes and vape devices specifically. So this gentleman you're seeing on screen, his name is Han Lick, and he is the one who's credited with creating the first commercially successful e-cigarette. Now the story in the background behind Mr. Lick is interesting because he himself was a combustible cigarette smoker. And he came from a family of smokers. His father himself was addicted to cigarettes. And his dad died of lung cancer in the mid to late 90s. And this affected Mr. Lick profoundly to the degree where he's a researcher, a pharmacist. He took it upon himself to go into the lab and use his training to come up with a device that could help people like himself, people like his father, people that are addicted to combustible cigarettes quit smoking. He came out of the lab with his patents and products ready to roll out in 2006. And essentially what he came up with was a way to heat a liquid form of nicotine in a battery-operated device, like an e-cigarette. So an e-cigarette will heat the nicotine e-liquid. This nicotine e-liquid has varying strengths, has a high strength, a medium strength, a low strength, and then there's a potential for having a zero nicotine solution. And the model is to scale down your nicotine strength so you can switch from combustible cigarettes to e-cigarettes, slowly decrease the level of nicotine you're using in your e-cigarette, and the ultimate goal is to quit smoking, quit vaping, quit using any nicotine products. So in the beginning, back in 2006, some of the very first e-cigarettes to come out on the market looked like the products you're seeing on your screen. This is considered the first generation of e-cigarettes. The one on there actually looks just like a cigarette and is the same size. Next one to that looks just like a cigar, is also the same size as a cigar. So what the devices look like, how they felt in your fingers and in your hands was very much trying to promote this as a cigarette, promote it to adult cigarette smokers. Now, this first generation, I'd like to just point out, had multiple levels of nicotine strength. Nicotine solution is measured in milligrams per milliliter. So the highest strength at this point in time, these devices were using what they term freebase nicotine solution. The highest at this point in time is 36 milligrams of nicotine per milliliter. Middle of the road would be about 12 milligrams of nicotine per milliliter. A low dosage would be around 3 milligrams per milliliter. And then, of course, there's a zero nicotine solution, 0 milligrams of nicotine per milliliter. I would also like to point out that at this point in time, these devices were disposable, so they're not refillable. You can't add on it, you can't smoke to the end of it and then add another cartridge. And these products were also non-rechargeable. So once your battery dies on the product, it's trash. Okay, you can't put a new battery in, can't recharge it. The advertising around this time was very similar to cigarette companies' advertising. So I got on the screen here a print advertising from a magazine. This one is for Newport, which is a very popular menthol cigarette. Next to that is Blue, which was one of the very first commercially available e-cigarette companies on the market. And you can see from these, the types of this advertising imagery, it's very, very similar. So at this point, the industry was really looking to move over combustible smokers, cigarette smokers, to give e-cigarettes a try. So these types of products persisted for about 3-4 years. A lot of people that were addicted to combustible cigarettes started using these products. They stopped smoking, and they started feeling healthier. They started feeling like they could, their taste buds were tasting foods better. They would climb, 5 flights of stairs and not be out of breath like they used to be when they smoked cigarettes. So they thought that this is the answer, and they took out loans, and they wanted to give the gift of vaping to all their friends that were addicted to cigarettes to better their health. And they opened up vape shops. So a product that first came on the market to move combustible cigarette smokers to something that they quote unquote were selling as more healthy, quickly started gaining more and more momentum as an actual industry. So by about 2010, 2011, a second generation, a second evolution of e-cigarettes was made available. And these are the products that you're seeing on the screen now. Many of these products go by the names of either mechanical mods or box mods. The mod is just a shorthand for modifiable. So a lot of these parts in these devices are interchangeable. The big difference is the look of the devices. They're a lot bigger than the ones that look like cigarettes. So part of the reason for them expanding in size, on the bottom, you can see that they're all bigger. okay? And that's because they have these really big lithium batteries in them now that are rechargeable and replaceable. So the mech mods are the four, the ones that look like cylinders on the left, and then the three on the right are box mods, and the bottoms of those are even bigger than the mechanical mods because those have enough space for 2 lithium batteries. Okay, so not only is it giving you a longer charge for your vape device, but as I said, they're modifiable. With 2 lithium batteries in there, you can actually modify the temperature that you're going to be heating up your e-liquid with. Part of the reason for that is the higher the temperature of your heating element, the bigger cloud production you're going to have, okay? Or the bigger vape cloud, smoke cloud production you'll have. I also want to point out that the tops of these things are bigger, also because they went from non-rechargeable to rechargeable. They also went from non-refillable to refillable. Okay, so the tops on all of these devices can be unscrewed, opened, and you can refill your nicotine e-liquid by just pouring it in with a bottle or a dropper. You could put multiple flavors into these devices. You can make your own flavors and put them in there. You can actually literally put anything liquid that can be aerosolized through heat into these devices, which is kind of scary when you think about it. At this point in time, the nicotine liquid, what they call the e-juice, was still a freebase nicotine solution, and it still had high, medium, low, and 0. And it still stuck with high being 36, medium being 12, low around 3 milligrams, and 0 is 0 nicotine. Advertising around this time changed slightly to look kind of like this, not only in look, but in messaging. So on the one hand, on the left side, you see that smoking combustible cigarettes are framed as a deadly habit, right? A dirty one, you have ashtray, you have cigarette butts. And then the larger part of the ad has a young gentleman blowing a giant vape cloud. And inside the cloud, it says, start the hobby. So stop the habit, start the hobby. And this is an advertisement for Uncle Junk's Genius e-juice back in 2012. So when you frame something like a hobby, you're definitely changing the way people view a product. Okay, when you think of hobbies, you think of things that are fun and recreational. I don't know, you think of like collecting stamps, flying kites, knitting. You don't think of breathing in giant clouds of chemicals and exposing yourself to, nicotine, which is one of the most addictive chemicals on the planet. So as I mentioned earlier, an industry was growing into the small $1 billion range. Advertising was changing. And a bit of a subculture started taking hold with vaping. Okay. So what I'm showing you here is a flyer for a competition. They actually have vaping competitions where there's a first place cash prize of $5,000. And the competitions happen all over the country. In the two images you can see next to that flyer, we have 2 pictures from 2016, a trick vape blowing competition and a men's cloud competition. So gentleman with the red hat is doing some sort of trick. There's dozens, if not hundreds of these tricks and tutorials, videos online and on Instagram, ranging from, jellyfish to ghosting to Cheerios. There's got all kinds of names for these things and different looks. And then in the bottom photo, you can see the men's cloud competition is actually a screenshot from a video competition that was held here in the state of Hawaii at a store called Fly High Hawaii. And the gentleman's blowing a 7-foot cloud, vape cloud. You probably can't see on his t-shirt, but on the t-shirt, the messaging there says vape with aloha. So you can start to see that there's competitions, there's clothing, vaping. In the last slide, start the hobby. You talk to a lot of diehard vapers that live what they call the vape life. Vaping is a lifestyle, and it's packaged and sold that way. When you look at a lot of these companies' accounts on social media, they're really selling a lifestyle. We can't discount. So there's vape stores, vape companies. A lot of these products, a lot of these juices come from overseas. But the tobacco industry was present from the beginning, and we can't discount them. And they are taking over the vaping industry in the last year and a half. So we can't discount them. They make tremendous amounts of money, so much money that they can afford to spend $1 million on advertising their products alone every hour. Okay, so I'm not talking about $1 million a day. We're talking about $24 million a day, $1 million an hour marketing their products. Okay, and unlike cigarettes, where you can't see cigarette ads on the TV, you can't see cigarette ads on the internet. You can see e-cigarette ads while watching the Super Bowl. You can hear e-cigarette and vaping ads while you're driving around in your car listening to the radio and in magazines and online as well. So $1 million an hour pays for a lot. Okay, so according to the CDC, $1 million an hour puts e-cigarette ads in front of 4 out of every 5 middle and high school students in the United States. Okay, and you can see the percent of students exposed to e-cigarettes ads has just been growing since 2014. Most recent data I can show you is 2016. That's a full 4 years ago at 78% of students exposed to e-cigarette ads. When you look at where they're being exposed the most, the largest number is in the retail environment, 68% or 17.7 million. And you could go into any 7-Eleven or gas station store that sells soda, chips, cigarettes, e-cigarettes. And before you even walk through the door, on the door itself, you'll see ads for cigarettes, you'll see ads for vaping devices. These are all paid placements by these companies. Then you go in the store and you see these products being placed at the kids' eye level next to products that kids would be interested in purchasing. Okay, and that's all done very consciously by the tobacco industry, and there's a lot of research through their documents and their strategies to verify this. Which brings us to this photo. This is from around 1998. The CEOs from some of the largest tobacco companies. Now, this is all related to the Tobacco Master Settlement Agreement entered into in 1998. And the short story of this could be a whole presentation in itself. But basically, so many people died from smoking cigarettes that the states got together and sued the tobacco companies. Tobacco companies were called in front of Congress and swore that, oh, these products don't kill people, nicotine's not addictive. Okay, but they got caught lying and they had to pay millions of dollars. And a lot of that money went to fund anti-smoking, anti-vaping prevention campaigns in many, many states. One of the very interesting things that came about from the Tobacco Master Settlement Agreement is all their documents, their memos, their internal documentation was turned over. And researchers basically went through and researched all of their inside documents, and it was confirmed. They knew that these products were deadly. They knew that nicotine was addictive. And one of the very interesting things that came out of their marketing strategies is that they viewed high school students as the base of their business. And that's a direct quote. And the reason for that is they knew that 90% of smokers, 90% of their customers start before the age of 18. Okay, so they knew that for many, many years. So they made effort after effort to make sure that people under the age of 18 had access to their products, could get their products, viewed their products in a certain light. And that's very, very disturbing. And we can't discount where we are today with e-cigarettes, because a lot of the things that the e-cigarette industry is saying today echoes a lot of what the tobacco industry said leading up to the 1998 Tobacco Masters Settlement Agreement. So I'll share this photo with you, which is from February 5th of 2020. And these are the CEOs of the top 5 e-cigarette companies in the country. The one on the far left is the Juul CEO. Blue is there somewhere. And basically they were called in front of a congressional committee and questioned about their marketing tactics, the health risks of their products, all in context and in perspective with the youth vaping epidemic. Okay, and the testimony from them is very, very enlightening, appearing not to know the dangers of their devices and the chemicals that people expose themselves to. So all of this to bring us to the latest generation of e-cigarettes and vaping devices, which is on screen now. And this is what we call the pod and cartridge based systems. So we had the first generation was non-refillable, disposable devices, okay? The second generation I showed you was more the modifiable versions, the mech mods and the box mods, where you've got big batteries, you're blowing these big clouds. We still definitely see those today. But the current generation of e-cigarettes and vapes that most youth are addicted to and are using are these ones that you see on the screen. Just to go through down the line here, on the left is the Juul. Next to that is a SMOK device, S-M-O-K. I believe that's the Nord or Novo. And next to that, the 2 devices in black are Sorens, the Soren Drop, the Soren Air. The next 2 are also made by SMOK. I think one's a Rolo Badge. I forget what this purple one is called. And then the one on the end, bookending on the opposite end of the Juul looks like a Juul, but it's called a Fix. Okay, so these are some of the biggest, most popular e-cigarette vape devices today. Now, all of these devices are very, very small, small enough that they fit in the palm of your hand. If you're a middle school student, high school student, adult, and if you close your fingers over your palm, it's totally concealed in there. So it's very, very small, very, very stealthy. Remember, these are devices that deliver nicotine, which is one of the most addictive substances on the planet. So I don't think it's by chance that these are so small and so stealthy, and so many teens are addicted. The one thing I want to point out with these devices, other than the size and shape, is very, very different from anything that looks like a cigarette or behaves like it. All of these devices come with either pre-filled cartridges and pods or refillable ones. Okay. Now, the last point I want to make on this issue is not only did the devices evolve, but the nicotine e-juice changed and evolved from what was prior used was called freebase nicotine solution to what they're using now in these pods and cartridges, which is called a salt-based nicotine solution, also known as salt nic. If you're in the stores looking at e-juice, it's salt nic. So the differences between salt nic and freebase nicotine is kind of scientific in the sense that there's a different pH level in terms of the acidity of the actual liquid. But Juul is the company that basically led this evolution. And they added an acid particle to freebase nicotine. And essentially what it enables these companies to do is use much higher doses nicotine in a much smaller amount of liquid, okay? So where we went from a free-base nicotine roster for 36 being the high, 12 being middle, 3 being low, and zero nicotine being zero nicotine, that last level before you totally quit smoking and vaping. With a nicotine salt solution and products, the highest is not 36, it's almost double. I've seen nicotine salt solutions, pods from Fix at 70 milligrams of per milliliter. So that's one of the highest. Middle ground, middle of the road is around 50, okay, which is way stronger than the highest in freebase, which was 36. Then the lowest nicotine.
Hi everyone, this is Steph. I see that Kevin's video got frozen, so we thank you everyone for messaging in. We will contact Kevin and figure out what's going on. Please hold on. Thank you. Hi everyone, it looks like we lost Kevin, but hopefully he will be able to jump back on and pick up right where he left off. We are trying to get a hold of him right now, so sorry for the technical difficulties, and hopefully we will be back online here. Oh, there he is. Kevin, can you hear us?
Yes, I'm back.
Okay, awesome. Thank you everyone for your patience.
I don't know where I died off.
I don't recall the last thing you said before you froze, but let's see. Small dose is what you're talking about, the nicotine pot, 70% salt. So thank you to everyone on the chat for helping us out.
My screen is still showing.
We don't see the slides.
Okay, hold on a second. Okay, let me try and share my screen again. How are we looking now, Steph?
It looks like we see, okay, we're good.
We're good?
Yes.
Okay.
Thank you so much.
Oh, geez, no worries. So yeah, back to the nic salts, much higher dosage of nicotine than freebase nicotine solution. So 36, 12, 3, 0. With nic salts, it's 70, 50, and lowest I believe is 20 or 30. And there's no nic salt. Okay, so we went to a product that was released as an aid to quit smoking. It's doing the total opposite now. It's addicting a whole new generation to nicotine as quickly as possible. Okay, so I want to walk you through a comparison, if this will let me, of cigarettes versus pods. Now, a pack of cigarettes has about 20 cigarettes. Each cigarette itself could contain anywhere between the range of 3 to 6 milligrams of nicotine per cigarette. But cigarettes behave quite differently than e-cigarettes. Cigarettes have a start point when you actually ignite it, and an end point when it gets down to the butt and you're done, you toss it and you go back to your business. Very clear start and finish. E-cigarettes don't have that. You could start when you put a new pod in, and you could end when you finish the pod. And then when you're actually using the product, you have to light a cigarette and finish it and be done. E-cigarettes work on batteries. When you're smoking a cigarette, half the time you're not even smoking it, right? You're looking at your phone, you're talking to your friend. Anytime you take an e-cigarette to your mouth and inhale, you're getting it, okay? So long story short, with a cigarette, I know it has about 5 milligrams per nicotine per stick. But since you're half the time your cigarette's just smoking itself, by the time you're done with one cigarette, your body's actually absorbed only 1 milligram of nicotine. Okay, so a pack of cigarettes, 20 milligrams of nicotine. Some heavy smokers will do a pack a day. Some will take maybe 3 days to smoke a whole pack. Okay. The next thing I want to show you here is the Juul pod. That's the gold bottom one. Comes in at a 0.7 milliliters in the Juul pod capacity. Now, Juul came out in 2015. The first nicotine strength they had was a 5% strength. 5% seems really low when you just think of it off the bat. Secondly, all e-cigarette products were measuring nicotine strength in milligrams per milliliter. So to come out with a new product, 5%, for teens, they're not going to know what that means other than think, oh, 5%, that's low. Most teens surveyed, are you aware that Juul has nicotine? They're like, no, okay? But that aside, when you actually look at the paperwork, when you look at the Juul site back in a couple of years ago, it basically said that their 5% pod equaled in nicotine strength to 59 milligrams per milliliter. Okay, so right there, 59 milligrams per milliliter, way higher than the highest in freebase at 36, right? So it's not 59 cigarettes because that would be the capacity if the pod was 1 mil. Since it's 0.7, you finish a Juul pod, 5% strength, you've consumed nicotine equivalency in cigarettes of 41 cigarettes. The next one's a fixed pod. Fixed looks just like a Juul. It's a little bit longer and the shape's a little bit different. Those pods have a bigger capacity, 1.5 mil. Now, fixed makes many different strengths. The highest I've seen was 70. But just to keep with the comparison to the Juul pod, if you put the 50 milligram nic salt in a fixed pod and consume 1.5 milliliters, you're approximately getting the nicotine equivalent of 75 cigarettes. Now, the last one on here is a Soren. Now, Juul and fixed come pre-filled. Okay, so those are pre-filled flavor pods. The Soren comes empty. It's refillable. So when you buy a Soren, you also have to buy nic salt juice to put in it. Has the biggest capacity at 2 mils. Okay, you put 50 milligram strength in there, vape the whole thing. Nicotine equivalent in cigarettes is of 90 cigarettes. So you get the idea how nic salt just packs much more of a nicotine punch. It wouldn't be a big problem if someone was using a Soren pod, 90 equivalent cigarettes, and it took them a month to smoke that pod, or a week. The problem we're having, the problem we're seeing with youth today is youth are going through one of these pods, whether it's the Juul, the Fix, or the Soren, in a day, possibly in an hour with friends. Okay, so some of the results that we're seeing, other than teens getting addicted to nicotine and having to, buy all kinds of vape devices and juices, on the extreme end, we're seeing teenagers whose lungs are collapsing. Teenagers who are having tears and holes in their esophagus from puffing and vaping too much. There's an open investigation by the FDA. Hundreds of people have had seizures from vaping. And part of that could be attributed to too high doses of nicotine in a person who's just not ready to handle that high level of nicotine, particularly kids. But to move along, I would like to cover now the health risks of vaping. Well-documented report came from the Surgeon General, particularly examining health risks for teens and young adults. This came out in 2016. It boiled it down to 3 main points for health risks. The first one is using e-cigarettes, using vapes, increases bronchitis and respiratory symptoms, respiratory problems. That's a no-brainer. We don't need the Surgeon General for that. Kids know that our lungs are meant for inhaling the clean air that we have. Anytime you're smoking a cigarette, vaping an e-cigarette, breathing in fumes from traffic, from a bus, from a campfire, it's not good for your lungs. Okay, and definitely using cigarettes and e-cigarettes daily, puffing on those chemicals, is going to cause a multitude of different problems. Secondly, we know that secondhand smoke kills 1.2 million people globally a year. So we know that secondhand smoke is just as dangerous. So why would secondhand vapor or secondhand smoke from e-cigs be less dangerous than vaping yourself? We have the studies that show that those carcinogens, benzene, acrolein, formaldehyde, and others have been measured just in exhaled vapor. Okay, so 25% of teens vape in Hawaii. That means 75% don't, but that 75% might be exposed to vape clouds from their friends, from their family. So it's good for them to know that even being around it and breathing it in is not good for them. And then lastly, the new scientific data shows that nicotine can do damage and harm, can cause harms to teenagers and that different harms that it can't do to adults. And the reason for that is because the human brain fully develops by the age of 25. Okay, so teenagers are very, very susceptible to nicotine, more so than adults. And in that same sense, their brains haven't fully developed yet. And when we look at the human brain, the brain develops in a human from the back to the front. So the part in red there is called the prefrontal cortex. So if a teenager develops a nicotine addiction, experiments with nicotine, this is that prefrontal cortex is where some of the development can be harmed. Okay, and that part of the brain is responsible for very important things like your memory, your attention span, your concentration, cognition, impulse control, etc. E-juice, the components that make up e-juice and e-liquid, it's all chemicals. So you have your nicotine, you have your PG, your VG, and your flavoring. Now, nicotine, PG, and VG are single chemicals. Flavoring could be multiple chemicals. So we'll go through these one by one. Now, we know that nicotine is very, very addictive. It can even be fatal. Okay? And that depends on how strong it is. And it also depends on, dosage, and also depends on the person. So obviously, a little bit of nicotine can be very harmful for a young child and be totally not harmful for a fully grown adult. What I want to bring your attention to is that e-cigarettes came out in 2007. By 2011, high school kids were using these products. What you see on screen in the green boxes is in 2012, there was 460 calls to poison control centers, emergency rooms, from parents, from adults that said that their young child, typically under the age of 6, got into their e-liquid. I don't know if they got into the e-cigarette. They opened the bottle, but it looks like they're having a seizure. They're having a convulsion. What do I do? The number of calls grew from 460 in 2012 to 1,500 in 2013, up to 2014, almost 4,000 calls. Okay. And that problem didn't go away. In 2019, cases of those calls almost hit 5,000. Okay. So even with child protective caps on these bottles, kids are still finding a way to get in these products and drink e-liquid and get sick. Kids have died in the United States and in other countries from e-liquid poisoning because they got into e-juice, drank it, and unfortunately died. So it begs the question, obviously, why would a 5-year-old pick up a bottle of e-juice and drink it? So I'm going to show you some products. The products on the left side of the screen, the juice box, the pink sticks, those are actually e-liquids, e-cigarette products. On the right side of the screen, the Treetop 100% juice and the Pocky are actually food products that kids are familiar with. Okay, so now you can start to see why a 6-year-old that's familiar with Pocky or a Treetop goes to a friend's house, and sees a juice box, smells it, it smells like apples, and they open it and they drink it, that they could get sick. I'll show you some other examples of products that kids are familiar with, that e-cigarette products are mimicking the advertising and packaging. Okay, so vape heads and warheads, candy versus e-juice, and Fruit Loops cereal versus cereal treats, e-liquids. And it really pushes into the forefront an idea that if these products are for adults that have been smoking combustible cigarettes for 5, 10, 15 years, are these companies trying to appeal to 45-year-olds with, Fruit Loop flavor and vape head flavor? I think they're really trying to appeal to those under 18, because they know that people that start smoking are under 18, and get young people interested in trying these products through these flavors. There's 15,000 unique flavors on the market. So all it takes is one flavor to appeal to a kid. Kid tries it. They know that companies know that there's nicotine, the most addictive substance in these products. They're going to be hooked very quickly. Okay. I mentioned PG and VG. I won't spend too much time on these two. PG stands for propylene glycol. VG stands for vegetable glycerin. Now, you can't just put liquid nicotine in an e-cigarette and vape it, because it would be too strong, number one. Two, it would taste really bad, number two. So no one would want to vape that, okay? So to deal with the too strong problem of the nicotine, you have to cut the nicotine solution with another chemical. And these chemicals, that's what they use propylene glycol and vegetable glycerin for. Now, propylene glycol and vegetable glycerin behave in the same way. When you heat those chemicals, they create visible vapor, visible smoke, like a smoke machine. Propylene glycol is used in smoke machines, in theater productions, and in concerts. And that's why, one of the main reasons why e-cigarette companies use these, because they want to appeal to those adults that inhale nicotine and want to see a cloud come out. They can do that with PG and VG. But PG and VG were not created by the e-cigarette industry. Okay, they had already existed on the market, used in many, many different uses, from antifreeze, because it has a very low freezing point. So that's another benefit for e-juice. It won't freeze, okay? They're also used in explosives. They're used in lotions and soaps, and in foods as a flavor and preservative. Now, PG and VG are both approved by the FDA for human consumption. Okay, and the vape industry prides itself on saying, we only use chemicals that are approved by the FDA. Okay, but there's an asterisk on that. Okay, so chemicals approved for human consumption means chemicals that you can put in your mouth and eat that goes to your stomach. Not the same thing as human inhalation. Okay, and that's what these products are being used for, these chemicals. We do have some data on what are the health risks of just vaping PG and VG, even without nicotine. Okay, this study from 2018 from the 19 from University of Pennsylvania. Long story short, propylene glycol and vegetable glycerin, when you inhale it, it leads to cardiovascular disease. Cardiovascular disease leads to heart disease and heart attacks, which puts you in that column of 480,000 people dying each year in the United States from tobacco-related diseases, which heart disease is one of the major ones. We're going to get into flavoring now, and flavoring chemicals, there's a lot of them. As I said, there's 15,000 different unique flavors on the market. But I'm going to use one example of a flavoring chemical that we know is harmful if you inhale it. We have proof that the e-cigarette industry is using this chemical. The chemical is called diacetyl. Now, diacetyl is a chemical used to impart a butter-like flavor to food products. So in edible form, not harmful. But in vapor and gaseous form, it's toxic and may cause obliterative bronchiolitis, or bronchiolitis obliterans. Complicated name, it's irreversible and potentially fatal lung disease. Some of you may not have heard of it, but if you've looked into vaping health risks, you probably heard of popcorn lung. And popcorn lung is another name for bronchiolitis obliterans. Okay. Now, it's called popcorn lung, not because it makes your lungs look like popcorn, but because Remember, diacetyl is a chemical used to give butter flavoring to foods. They use it in butter flavored popcorn. Workers that were in those popcorn factories were breathing in diacetyl. This was in the 80s and 90s. They came down with bronchiolitis obliterans. They all got together and sued the popcorn companies. And in 2004, 2010, they got $30 million, $20 million settlements. Okay. But in 2015, there was new studies that show that vaping could cause popcorn lung cancer. Now, what does that mean? We'll get into it. Before we get into it, I just want to show you what the condition of bronchiolitis obliterans looks like and what it does in the lungs. So inside the lungs, there's what they call the respiratory tree, which is the windpipe and the bronchi, which are basically large branches that bring oxygen and distribute it through the lung. At the end of the bronchi are smaller tubes called bronchioles. Okay? Take a close look at a bronchiole here. It's the top part of this screen right there. This is a cross section of a bronchiole. A healthy one looks like a straw or a pipe. Lots of oxygen, carbon dioxide can go in and out unobstructed. Breathing in diacetyl causes inflammation of the inside lining. That inflammation continues and then turns into scar tissue, and then it just repeats the process. So over time, the lining gets corroded, and just this little slit is left for oxygen and carbon dioxide, making it very, very hard to breathe. Could require lung transplant, lung surgery, or oxygen tank. So that's what popcorn lung looks like. In 2014 and 2015, there were two studies done. For 2014, a study of 159 sweet flavored e-liquids found diacetyl in 74%. 2015 study of 51 found 76% had diacetyl in it. I'm showing you some butter flavored, examples of butter flavored e-liquids. Buttermint, butter croissant. Do they have diacetyl? It's hard to tell. You'd have to look at the bottle itself. And I guarantee you the ingredients will tell you nicotine, propylene glycol, vegetable glycerin, and artificial and natural flavorings. It's not going to explain what flavoring chemicals specifically are being used for this flavor. Part of the reason is they don't want to, they consider it a trade secret. They don't want to put the 4 or 5 chemicals that are responsible for their butter flavoring in, because some other company might take those chemicals, put them together, and be able to replicate the flavor. Now, all of these food flavoring chemicals that are being used to flavor e-liquids, none of them are FDA approved or tested as to what it does to people's health when they're inhaled. Now, Flavora is a company. This is a screenshot from Flavora. It's an online company that sells food flavoring chemicals. I can't read everything on this slide underlined in red, but long story short is they know that this product contains compounds that are hazardous to your health. There's no FDA approved flavoring for inhalation. More importantly, and this goes back to that divide of cigarettes and e-cigarettes, these companies want to keep that separate. But when you look at the health risks are close to one and the same. And it speaks to that in this warning. At the bottom here, it says exposure to the aerosol of these chemicals can trigger, aggravate, and exacerbate various adverse health effects, including but not limited to cancer, carcinoma, addiction, birth defect, heart disease, liver and kidney disease, and so on and so forth. So it's actually in the flavoring chemicals where a lot of the most recent study is finding some of the most dangerous chemicals that do most harm to the lungs and lung tissue. And why is that important for 808NOVAPE, for any of us working in education of teens? It's because that 97% of youth who vape use one of these 15,000 different flavors, okay? Now, a lot of people say, oh, we have to wait, 10, 20, 30 years to see what the health effects of vaping are. Well, we got ourselves an up close and personal preview of what short-term, long-term vaping can actually do to lungs and lung damage last year in 2019. And basically, thousands of people were hospitalized. Many of them were teens and had trouble breathing. The common denominator was that they were vaping. Okay, so this condition was termed EVALI, and EVALI is an acronym for e-cigarette and vaping associated lung injury. Now, this all started in Milwaukee Wisconsin. July 25th was the first headline. 8 Milwaukee teens were hospitalized. Severe lung damage, had trouble breathing. Only common denominator was that they had been vaping. Within a week, that cluster of 8 grew to 11 by August 2nd. The August 2nd cluster grew from 11 to 22, again in the Midwest, okay, by August 15th. Okay, so while I was looking at these stories, I thought, that's kind of weird. But it was very interesting because it was really localized in Wisconsin. Made us think maybe they're vaping something different there. But a couple weeks later, it was confirmed that no, it's not local to Wisconsin. It's 300 cases nationwide. Okay, and this is a headline from August 29th. Okay, so this is when things are just starting to ramp up. Month of September comes along, lots of headlines like this. Okay, a lot of teens almost dying from vaping. Common denominators, they vaped 6 weeks to a year. Most of them, as most of the stories started coming out and investigations were being conducted, started vaping nicotine products, and then somewhere along the line, started vaping THC products as well, okay, and got sick. Now, these 3 teens on screen are from different parts of the country. So Hawaii, obviously, we have a vaping epidemic. We've had one for a while. We have our own cases of EVALI. The first one was announced September 10th, an underage girl from the Big Island, hospitalized and recovered, thankfully. But not all teenagers and not all people, unfortunately, did recover. People had been dying up until September, but the first teenager to die his name was Dennis Bird Jr., 17-year-old from New York City. So this happened early September, or was it October? And then the other headline that really hit home was this one. This 17-year-old teenager by the name of Daniel Ament. His lungs were so damaged from vaping that he required a double lung transplant. Okay. In recent news, I know coronavirus has kind of taken over everything, but this is a headline that just popped up last week, April 14th. And this is a 16-year-old named Riker Shamblin from California. Now, Riker woke up one day and told his parents he couldn't breathe. He had trouble breathing. They went to urgent care. Urgent care basically took an x-ray and they saw some haziness in his lungs. They said, looks like you have pneumonia. Take these antibiotics and go home. Well, within 3 days, his condition severely worsened, could barely breathe. They took him to the emergency room. First thing they did was they thought he had COVID-19. They ran a test for COVID-19 and were about to put him in ICU and treat him for COVID-19. Test came back negative, okay? Then they all looked at each other and said, what's going on? Nurse went through his sweatpants, found 2 vape pens. Took another x-ray, put him on the EVALI track. He recovered. He spent 8 days in a coma. He lost 30 pounds, but he recovered. And this is the most recent case of EVALI to make the news. Makes me wonder how many other teens out there might be having trouble breathing due to vaping, due to EVALI, and getting fast-tracked for COVID. Now, the CDC, which was tracking EVALI cases and updating their website every 2 weeks, hasn't updated since mid-February. So as of February 18th, there's been 22,807 cases of EVALI in all 50 states. On the map here, the darker red states are where there's been deaths. There's been about 68 deaths caused by this since last summer. First death of 2020 was a 15-year-old teenager from Texas. So this is hitting younger and younger teens. I want to close out by just showing 2 resources that are available for teens addicted to vaping that would like, if they want to quit, there's support out for them. So the first one here is the Hawaii Tobacco Quit Line. If you're in another state, each state has a quit line. But this is for teens 13 to 17 to actually make a phone call and talk to a cessation specialist and receive counseling in real time over the phone. how to come up with a quit plan and support for that and encouragement. Curiously enough, teens today, they don't like talking to people too much. They'd rather just, text. We have something for you too. There's a program called This Is Quitting. It's through your messenger. So a teenager could just open up their messenger app and text the word ditch Juul to the number 88709. They have to be at least 13 years old. They'll get the same type of counseling delivered via text. And essentially what it is evaluating how much nicotine, how much vaping is the teen doing? 100 puffs a day at 50 milligram strength. Well, then we set a quit date, 6 months, 3 months, a year out, 18 weeks, you name it. And we set up a plan to reduce puff count, daily puff count from 100. How about we try 90 tomorrow? We get through that, we'll do 75 the next day. Then we look at nicotine strength and try to reduce that as much as we can down to 0. So there are services that are available. And then last but not least, I just want to bring your attention to the campaign that we have here in Hawaii to end the sale of flavored tobacco products. It's flavorshookkidshi.org. If you're here in the state of Hawaii and want to get plugged in and support that event, but if you're from other states, this is happening in many other states as well. So I know that I'm a little over time, and I want to save some time for questions. I'll put my email up here. It's kevin@hifi.org. And without further delay, I'll turn this back over to Steph. If you have any questions for me, I'll try to answer those.
Awesome. Thank you so much, Kevin. So just a reminder, if you have any questions, please put them into the chat box or the Q&A box at the bottom of our screen. So we have about 10 minutes. So Kevin, first question is, why does Hawaii youth have a higher percentage of vaping?
That's a really great question, and it's a question that always seems to come up at presentations. So the answer is not, I don't have a definitive answer for that. As I covered in my presentation, when these products first came out in 2007, the first survey was done in 2011. And it was nationally 1.5% versus Hawaii 5%. There's been a couple recent articles done, and I think they were on Civil Beat's website that looked at this issue. And actually found that Hawaii has more vape shops, and especially our neighbor islands, per resident or per capita than most other places. So that is one attributable reason. A second one could be that the longest standing vape industry presence here in Hawaii is Volcano and Volcano e-cigs. And when e-cigarettes first came out, they started right away. They credit themselves as being the first vape company to actually have a vape lounge, which is, they don't have that here in Hawaii anymore, but it's a shop you can go into. There's couches. You can basically sample as many different vape flavors as you want and then make your purchase. That is not legal anymore in the state of Hawaii, but at one point it was. And I remember the last thing I want to say about this is I was doing a presentation at an elementary school, and the principal came up to me afterwards and said, when these things first came out, I remember it was in 2008, 2009 when she first remembers seeing them. And she says she remembers adults and kids teens lining up to buy these products, because at the time you could buy them if you were under 18 years old. Okay, so some of those reasons might attribute to why Hawaii has such an elevated rate. There might be some that I haven't mentioned. Okay, so hopefully that helps figure it out, adds a piece to the puzzle there.
Thanks, Kevin. Okay, so next question is, I think this is from early on in your presentation. Could you please repeat the yearly count for flu, tobacco, and COVID?
I looked it up, interestingly enough, this morning. So the World Health Organization estimates each year globally, the flu kills from 250,000 up to about, I think it's 500 or 600,000. And that's globally, okay? So COVID deaths up to date I checked this morning, we're about 188,000 globally. Okay. Was there another part to that?
Sorry, it was flu count, tobacco, and COVID.
Okay, so tobacco globally is 8 million. Flu globally, estimated by the World Health Organization, is at highest count maybe 600,000 a year. Current COVID deaths worldwide are around 188,000.
Okay, thank you. Next question is DOH planning on exploring usage of e-cigs and alcohol in the elementary schools?
In terms of the surveying, I'm not sure. That's a good question for some of our friends at Department of Health. I'm not sure if there's a legal issue in terms of that, or if it's just the sense that they don't want to initiate use by exposing elementary school kids to, oh, there's beer out there that I could try, there's vaping, there's all these different drugs I could try. I'm not exactly sure what the answer is. But certainly we could do some research, some polling among elementary school age kids ourselves and find out what the actual rate of elementary school vaping could be for a particular school. That would actually be a very interesting project.
Next question is there an article to refer to for the documented carcinogens in e-cigs mentioned in this presentation?
Yeah, I would say the first document to go to would be the Surgeon General's report from 2016. I believe that's easily available online, but if I have it, I mean, I'm willing to share it with anyone who'd like to see it. And beyond that, there's studies that come out literally like every month that have come out since 2016. A lot of the examination of the hazardous effects of actually flavoring chemicals on lung tissue was done in 2017, 2018. So I would be willing to share not only the Surgeon General's report, but the studies on other carcinogenic chemicals that come from flavoring chemicals, or sometimes they're coming from the actual components of the e-cigarette, like the metal coil or the plastic components of the pods themselves.
So this is more of a comment, but if you have any thoughts, it would be interesting to know if some of the younger people who have died from COVID-19 were vape users.
Yeah, that is obviously a big issue right now. You know, every day there's probably like 2 to 3 articles that come out that say, does vaping or smoking contribute to COVID-19, or does it make worse outcomes for COVID-19? So the short answer for that is that there's no scientific data that we can say that smoking definitely leads to COVID-19. But what we can definitely say is that using tobacco products, whether that's cigarettes or e-cigarettes, creates inflammation in the lung cells, in the lung tissue, can lower one's immune system. So those two components taken into consideration with the threat of coronavirus and COVID-19, obviously the sensible thing to do or to think is that if you smoke or if you vape, it's possible that you could develop, worse symptoms of coronavirus or COVID-19 than someone who doesn't vape or doesn't smoke. Do we have definitive proof of that? Not yet. I think there's one study from Chinese CDC, that showed that there was a higher percentage of fatalities recorded, and the people that died were smokers, not vapors, were users of combustible cigarettes. So, I mean, time will tell on that. But there was one article that I did see, I forget what state it's from, but it is on the 808NOVAPE.org website under news, where I think it was an 18 or 19-year-old snowboarder who vaped a lot, came down with COVID-19, recovered, but I think he went, his quote is that he thinks that vaping contributed to him getting COVID-19.
Next question is, I've heard e-cig users say it's not harmful to use around others because, quote, it's vapor and it evaporates in the air. You can't even see it, end quote, which of course is false. Are there studies that show how long these chemicals can stay in the air?
I believe they do exist for cigarettes. I believe I also saw as recently as this month the first confirmed actual study to show that secondhand vape is damaging. Now, the industry, of course, wants everyone to believe that it's just harmless water vapor. But there's a really good exercise that the Stanford tobacco prevention folks do where they have a little spray bottle with water and they shoot it into the air and under your skin, and they say that this is water vapor, and when you feel it, it's wet, but it's going to dry completely and not leave a residue on your skin. And then they take a can of hairspray or spray deodorant, anything that sprays out an aerosol, which is what vapor is from an e-cigarette, and they spray that in the air and they spray that on your skin. And then the person feels that, and it does feel wet, yes. It feels like it's going to dry for sure, but it's definitely going to leave a sticky residue. So that's an example of how vapor is. When it starts in a liquid form, it's through heat, it's aerosolized into this visible vape cloud, but then it again transforms into moisture. So in the lungs and also on surfaces. How long it stays active on surfaces, I can't tell you, but I'm pretty sure that there's a study that will confirm that for combustible cigarettes. Not 100% sure about the secondhand vapor study, but I'm willing to dig that up and share that with anyone who would like to see it.
Okay, and I do want to honor everyone's time, so this will be the last question. However, I have all the questions and your names, so if we do not or did not answer your question live on the webinar, we will follow up with you as soon as possible. So last question is, where might we get posters for quitting?
Good question. And I believe you can get those from the Quit line, from the Hawaii Department of Health that runs the Quit line. I believe they have posters available. So just probably an email or a call to them could get you some posters for that. I believe there are posters that exist for the This Is Quitting messaging app. I actually inquired, so Truth Initiative is the organization that's responsible for This Is Quitting. I reached out to them about getting posters, and they directed me to their website. So on their website, they have PDFs that you can print out to post in your community center, in your classrooms, in your schools, to at least have information on the wall for students that might be curious. It's good for them to know that there are services out there. There is help that they can get, that it does exist. And we're doing as much as we can right now to figure out how we can do even more to support teenagers and kids that are addicted to nicotine, get off of that, beat that addiction. It's tough because no amount of nicotine is safe for teenagers and kids. But some doctors will say that some teens' nicotine addiction is so bad that they'll sign off on giving kids nicotine replacement therapy as long as there's a quit date in mind and there's a reduction plan to eventually quit.
Okay, thank you, Kevin. So just real quick, I want to say mahalo to Kevin for joining us today and being our host of our webinar. Mahalo to all of you for joining in live. Couple reminders, if you joined us by telephone, please email me and let me know your phone number so that I can be sure to email you the evaluation form. The evaluation link will be emailed out to you later this afternoon, and surveys will be due back to us by close of business Monday, April 27th. The slides, the link to the slides, if you missed it in the chat box here, they are going to be in the Mahalo email. And this webinar is being recorded and will be posted on the Hawaii Public Health Training Hui's YouTube channel. Should be posted, if not later today, definitely by Monday. So again, want to say thank you. I'm forgetting one thing. I want to let you know that we are back on schedule, so we will be having a May webinar. So please mark your calendars, May 15th at noon. We will be sending out details, a flyer, and registration information as soon as possible. So again, thank you everyone for joining us, and we look forward to seeing you next month. Thank you.